Hello, everyone. This is Rochelle Seeger. I'm here at the Foundation for a Healthy Kentucky. I'm so pleased you have joined us here today on this Health for a Change webinar titled Homegrown Community Solutions to Increasing Fruit and Vegetable Consumption and Physical Activity in Appalachia. Thank you for taking time out of your day. I know everyone is busy. Our offices are here in Louisville. We serve the entire state of Kentucky, and it's a nice sunshiny fall afternoon, so thank you for spending time with us here today. First, a few things about the Foundation for a Healthy Kentucky. The Foundation for a Healthy Kentucky is a nonprofit, nonpartisan organization founded in 2001. The Foundation for a Healthy Kentucky's mission is to address the unmet health needs of Kentuckians. And the Foundation does that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. And this photo on the slide here is the tobacco-free campus signage that is here at our building in Louisville, letting visitors know that this is a tobacco-free campus. The Foundation values integrity, respect, effectiveness, leadership, collaboration, and policy equity. The Foundation for Healthy Kentucky's website is healthy-ky.org, and on the website you can find some history of the Foundation, the mission and vision, its current board of directors and advisory council, as well as information on the current Foundation initiatives. Two of those initiatives are coalitions that are led by the Foundation for a Healthy Kentucky. One is the Coalition for Smoke-Free Tomorrow, and the second is the very newly launched Kentucky Coalition for Healthy Children. And you're invited to join those two coalitions if you're interested in working on policy in Kentucky for those two important health issues. A reminder to everyone that's joining us here today that this call is being recorded, so you can share with your friends and colleagues later if you're so interested. Also on this webinar platform, you'll see on your screen there's a Q&A box that you can type in. When you type in those questions, they come directly to us, all of those presenters. So if you have questions or comments on today's webinar, we welcome you to share those today during our live webinar, and those come directly to us, the presenters. As I mentioned, the Foundation is governed by a board of directors and also a community advisory council. And that council's function is to provide the Foundation board of directors with advice and recommendations regarding policy and direction of the Foundation, and also to be a liaison between the Foundation and communities across Kentucky. The council is open for your nominations, yourself or another one who are interested in serving with us here to improve the unmet health needs of Kentuckians. You can find all the information about the Community Advisory Council on our webpage. Some of my work here at the Foundation is this Health for a Change training series, which I enjoy immensely, and it's also on some data initiatives. So folks who love data like I do will know that I'm sending you a post-event survey later this afternoon. It's a quick Survey Monkey. The average time is about 3 minutes. I would love for you to send back into me your thoughts on today's webinar and feedback for future events. That email will be in your inbox this afternoon. This training series is called Health for a Change. The Foundation for a Healthy Kentucky launched it in 2011, and it really was an effort to support all of the health coalitions, health nonprofits, health departments across Kentucky, to support them in their work to do that thing that we're trying to do, is improve health across Kentucky. And we've had a huge variety of topics from data equity to grant writing to health policy, smoke-free policies. And even last summer, I had the great joy to have an event with the folks at Kane Kitchen in Whitesburg, Kentucky. So it was a great honor for me to visit their community there. And this is the picture that we took when we first came into town going up to the lookout on Pine Mountain. Today's event and the past Health for a Change training series is on our website. You can also find the upcoming events. We have 2 upcoming webinars. One is next week on COVID-19 and health policy, and next Friday we will have a webinar on self-care. Again, all of these are free and open to our Kentucky community. This series is all about partnerships, so I'm thrilled to have a fantastic partnership here sharing their experiences about building health in our state. Again, I've had the opportunity to work with a fantastic group of presenters and Kentuckians who are working to improve health in our state. And I'm very happy to turn the program over to Dr. Dawn Brewer. Dr. Brewer.
All right, thanks a lot, Rochelle. So thank you all for joining us today to learn more about our community voucher and walking program. And as Rochelle said, my name is Dawn Brewer, and I'm going to start off our team presentation. So here's the outline for our presentation, and today you're going to hear from the main people involved that delivered the program on both the academic and the community sides of the program. So here are the learning objectives. I'm not going to read each one word for word, but essentially what we're hoping to get across is how we implemented the program and the challenges that we encountered, and also some of the great results that we discovered. So before I go further into the presentation, I'm going to ask Rochelle to go ahead and queue up our first poll question, just to get an idea of who has attended, who goes to their farmers market. So
thanks, Dr. Brewer. I've sent that survey to our participants, so it should be on your screen now. If you would take just a moment to send in your answer. All right, the responses are coming in if you haven't already answered.
Okay, awesome. So looks like a decent amount of folks do attend their local farmers markets. So looks like we have about 70, still going. Okay, I'm going to give people a chance to answer. Okay, so it looks like about 78% go to their farmers market. And so for those of you that do, think about when you go to your farmers market, consider, envision this program and, think about if you could have such a program at your local farmers market. So here's our team. And like I said, we were the main people involved in delivering the program, and we're also the team that is delivering this webinar. So I am on the left. I was the primary investigator on the academic side. Next is Annie Kemple. She's also on the academic side, and she was the program manager. Then we have Callie Blair. She was the community program manager. And then finally, we have Valerie Horn, who was the community primary investigator, who developed the concept of this walking voucher program. All right, so before I go into the program, I just want to mention how Val and I came to know each other. And it was through planning a community forum. It was called the Appalachian Health and Wellbeing Community Forum, and it was sponsored by the National Institutes of Environmental Health Sciences, and other known as NIEHS, and they happened to be a grant funder for the University of Kentucky Superfund Research Center, which I am a part of, and the UK Superfund Research Center has helped fund the walking program over the past couple of years. So with Val's help, also Mike Cottle and Teresa Dotson from MCHC, they helped us plan this community forum. And during these planning meetings, I went to Whitesburg a number of times, had a number of conversations with Val, and that's when she had described the walking program that she created in Whitesburg. So now I'm going to hand it over to Val to give a little bit of background information about how she came about creating this program.
Thank you, Dr. Brewer. Thank you, Rochelle, for having us, and thanks all who are taking their time to listen to this. So a little bit, and I'm Valerie Horn in Whitesburg, a beautiful day here, and I'm joined safely with our mask with one of our participant walkers, Lauren Sturgill. I thought it was important that we bring his background and participant background in this also. And the walking program began as just a simple idea about 5 years ago. And how do we promote and increase physical activity in the community, and as a bonus, tie that to healthier eating? Both of those we see as potentials to grow in healthier communities here, more exercise and better food choices. So this was a win in that we would just put this together, and there's a wonderful walking track in Whitesburg that is adjacent to the City of Whitesburg Farmers Market, and that's often the case in other communities as well. So the first year was pretty simple without the support from UK, and it was, if you walk to the market, you get $10 to spend at the market. And we were able to fund that first year through Marshall University and the Diabetes Coalition. That there are probably several other counties in eastern Kentucky that are a part of. But that was the first year, and then for the past 4 years, we have worked with Dr. Brewer and Annie at UK in gathering research that she's going to share with that. Lauren was here with us that first year, and I'm just going to ask Lauren Sturgill just to, if he'd give us a little bit of background on his perspective as he's been with it for 5 years also. Lauren?
Yes, thank you. This welcome program has been a vital part of Letcher County. We have a lot of people that's involved in it, and through this, they do get more exercise. They are eating healthier, which is causing diabetes to go down, causing blood pressures to go down. It's just an overall a healthier lifestyle. And through this walking program, it's just been amazing. This year's been a little upside down because of the COVID-19 situation, where we can't really be involved like we was last year, but it was great.
Lauren, can you speak just a little bit about you've had a leadership role in it, so a little bit about your role as a leader in the program, and also any personal effects that have happened with you?
Well, when I first started in the walking program, my A1C was 11. And after the first year, it was down to 5.3. Because of being involved in this program, it's taught me how to take care of my body better than I was in the past.
And you take that and spread that out and that out in the community too. Have you seen, or do you feel any impact with others in the community, or how has that gone?
Well, there's been a lot of impact with the walking program in this county. There's a whole lot of stories out there that I've talked to with different people in the program as it started till now, and it's basically giving people a step towards a longer life. They, with the healthy eating, with the exercise, one gentleman took his A1C down from 14 to 6, and has also, with the weight loss, also with the healthier eating.
Thank you, Lauren. And with that, the walking program has been a part of the City of Whitesburg Farmers Market. That just our goal is to grow a healthier community, one garden at a time. And with that, the walking program has been one aspect. The Pharmacy of Veggie Incentive Program activities for the youth. But the walking program has been a favorite. There have been no income guidelines. It's been open. There have not been health guidelines. So any person who wanted to participate in it had the opportunity to do that as far as our numbers would go.
All right. Well, thanks, Val. And thank you, Lauren, for sharing your perspective as well. So Val mentioned she started this in 2016, and then after we met and I learned about the program, I wanted to add a bit more rigor to the evaluation process. So meaning that I wanted to collect a lot of data, and in order to capture changes in knowledge, behavior, and also health indicators. So this slide shows an example of some of the educational tools that we used during the 16-week program. And essentially, we only encouraged people to walk each week to the farmer's market to redeem that $10 voucher each Saturday at the farmer's market and redeem their voucher with fruits and vegetables. So those that walked, they walked the community trail that's called the Tanglewood Trail, and it connects the housing authority to the farmer's market. And when you do that round trip, it's about a mile long. So before I go any further, Rochelle, go ahead and pull up the next poll question for me, please. And just a little bit of background, when we first did this study, one of the major questions was, would people walk for fruits and vegetables? So, Michelle, are you able to get that? There we go. Okay, so I'm interested to know from you all, would you commit to walking 1 mile most weeks during the farmer's market season in exchange for a $10 farmer's market voucher? All right, I'll go ahead and give you all a little bit of time to answer. Okay, so it looks like that the majority of folks would, with over 90% responding that they would. So that's great to hear. And fortunately for us, when we did this program in 2017, we had a good number of people that also said they would commit to walking, most weeks of the farmer's market season. So in 2017, we had 121 adults recruited. Mean age was about 50 years. They were predominantly white, non-Hispanic females. And for data analysis purposes, we broke them up into what we called high engagers and low engagers. So the high engagers were those that walked an average of 9 times through the 16-week program, and low engagers walked an average of 1 time through the 16-week program. So at baseline, we saw that high engagers tended to be younger, they were more likely to be married, to have fewer self-reported chronic health conditions, and they were less likely to be taking blood pressure or cholesterol medications. But with the exception of diastolic blood pressure, there were no differences in baseline physical measurements between the high and the low engagers. So we did observe some positive health changes, so we were really excited to see that. So within the low and the high engager groups, we saw significant decreases in hemoglobin A1C, total cholesterol, and LDL cholesterol. And LDL cholesterol is the bad cholesterol, so it was good to see that go down. So then when we looked at the changes in health indicators between the low and the high engager groups, we only saw a significant change in HDL cholesterol, which is the good cholesterol. We saw an increase in HDL cholesterol, and that's the direction that you want to see it go, and which we attributed to because to the high engagers walking more, because exercise is associated with something that people can do to increase their good cholesterol, the HDL cholesterol. So we saw these great changes. We also measured BMI and waist circumference and blood pressure. They didn't change significantly but they were moving in the right direction. So that was good to see. So based on this great success of our 2017 program, we saw that people were committed and that they were willing to walk for fruits and vegetables. Val and I were able to secure some funding for the 2018 program, and with that funding, we were able to add a bit more rigor to the experimental design. So what we did was we added a comparison group, which was located in Harlan, Kentucky, and we expanded the length of the program. We added an additional 16 weeks, and now we had a 32-week program, but during that additional 16 weeks, we added a meal component that was comparable to the $10 farmer's market voucher. So since the farmer's market was not year-round, we utilized a community kitchen in Whitesburg. That kitchen is called the Community Agriculture and Nutritional Enterprises Kitchen, and they prepared the healthy entrees that were loaded with vegetables that were provided weekly to the intervention participants. So what we ended up with, we were able to recruit 75 comparison participants who were located in Harlan, Kentucky, and we recruited 82 intervention participants in Whitesburg. So the intervention participants, they were required to walk 1 mile each week. For the farmers market portion of the program, they could walk that community trail together. When the meal portions of the program started, they had the option of continuing to walk the community trail, or they could move it indoors to the community center and walk the indoor track. We did include a nutrition education component through Facebook posts and recipe and phytonutrient cards. The comparison group, they received the same education, but they received it through a monthly newsletter. And of course, we collected data. We had people complete questionnaires, and we obtained physical measurements at 3 different time points throughout the year in May, September, and January. So at the end of the program, we found our retention wasn't necessarily the greatest, but again, just to remind you, we had people come back 3 different times. We asked them to come back 3 different times, so the data that I'm going to show you is just from people that came for those, for all 3 time points for those measurements. So by the time we reached the end of the study, we had 19 comparison group participants and 48 intervention group participants, and that equated to about 25% retention in the comparison group and 63% retention in the intervention group. When we looked a bit closer at our data, we actually realized that our retention rate during the farmer's market phase was actually pretty high. It was at 78%. It was during the meal phase that we saw participation drop off. And some reasons for this is that there was a change in schedule. So with the program starting in September, we had school schedules, so parents concerned about their kids and getting them to school. There was a switch to standard time, so less daylight, and also the season was changing. So we had to, people had to deal with colder temperatures. Also, this was our first time piloting the meal program, and I figured that we would learn a lot from our first program implementation that we could correct in the future. As far as the comparison group, I would say a big issue was that they just weren't connected. They weren't connected to each other, and they weren't connected to us, because we just sent them newsletters each month, and that was it. Also, another pitfall, I believe, is that at baseline, when we obtained those first measurements, we offered a $15 gift card. So I would guess that many people just showed up for the gift card and weren't really necessarily committed to coming back those 2 different times so we could collect measurements. So what did we find? Here's the demographic table for our 2018 study. So you can see the age is about 51 years. They were very similar in age between the comparison group, which is on the left column, and then the intervention group on the right. They were predominantly female again, non-Hispanic, white. There was a significant difference in education, with the intervention group having approximately 2 more years of education compared to our control group. All right, so physical health measurement-wise, we again measured changes in lipid panel through finger stick. We measured BMI, waist circumference, blood pressure, and dermal carotenoids. So dermal carotenoids was a new measure, and it is a non-invasive objective measure to assess change in fruit and vegetable consumption. And at baseline, we found that our participants, the intervention participants, were significantly heavier than the comparison participants. And intervention had greater BMI and waist circumference. But in general, at baseline, both groups were considered overweight, obese, hypertensive, and they both had low HDL cholesterol levels. All right, so we did see a significant change in BMI and waist circumference. So when we compared baseline BMI to post-farmer's market, and then when we compared baseline BMI to post-meal program, the intervention group had a greater decrease in BMI than the comparison group. And we saw this same pattern for waist circumference. So in other words, with the comparison group, their BMI and waist circumference, it didn't significantly change from baseline to post measurements. We just saw this significant decrease in BMI and waist circumference from baseline to post measurements in just the intervention group. So that was really exciting to see. But different from the 2017 study, we didn't see those changes in lipid measurements. But what another interesting finding that we saw and was really encouraging was to see a significant increase in dermal carotenoids. So post-farmer's market phase, the intervention group's dermal carotenoid levels were significantly greater than the comparison group. And this indicates that people were actually eating the produce that they were getting from the farmer's market. Unfortunately, we didn't see that elevation in carotenoids. It was not maintained by the end of the post-meal program. But what was good to see is that those levels, they didn't drop below our baseline. So that was encouraging, and I would say that was due to having those meals with all of those vegetables. But overall, the data collected from our 2 years of offering the walking program, it did show that our community intervention led to positive health changes, particularly in physical health. But as you will hear about next from Annie Kemple, our program also generated benefits that contributed to good health. All right, Annie, I'll turn it over to you.
Thanks, Dawn. So before I share some qualitative results with you all, Rochelle, would you mind pulling up our radio clip? This is a short clip from a longer radio spot, and I'd like to thank Appalachia, WMNT, and the Kentucky Department of Public Health for recording, editing, producing, and allowing us to share this with you all.
I make sure I sign up every year. I don't want to miss it.
Bob Smith is a teacher from Whitesburg, and he was one of several walkers we met on the day we visited the market. He says he was diagnosed with type 2 diabetes about 20 years ago.
I'm 61, and I'm in better shape in my 60s than I was in my 50s, and a lot of that is because of this program. My blood sugar level went from a 9-point-something down to a 6.1, so almost like not diabetic. But I mean, that's with my medication and the walking and trying to watch what I eat. But you have to jot down your mileage and stuff each day that you walk and stuff with this program, so it kind of makes you feel accountable. And like I walk these stairs up here by the old high school and the hills and things. I like to do that instead of just level ground. I think I could walk all day. I know I probably couldn't, but I feel like I could.
Well, you've got two choices. You either exercise or you take a shot. I'd rather have exercise than a shot.
Lauren Sturgill is also from Letcher County, and he helps organize the walkers every week. He also participates himself, and he says he had no idea he needed to worry about diabetes until getting an A1C, or blood sugar test, a few years ago.
My A1C was over 7 when I started the program the first year, and at the end of the program it was 5.3. And then I also lost about 25 pounds in it also. Feel like a new person. And, you know, you don't think you're exercising because you're talking as you go. Because, man, if I focus on exercise, I'll not make it halfway down the track. But if my mouths are running, I can walk to the end of the county.
What are you eating, Cole?
Blueberries.
What's your favorite thing at the farmer's market?
Blueberries.
I'm Hillary Beck, and I'm from Macon, Kentucky. We wanted to do the walking program because of Papa, because he's getting older in age, and it's actually helped him a lot. He's been cutting his own grass since we started walking, so he's getting his exercise in, and we've actually lost a couple pounds, and that doesn't hurt, does it? And the kids love it. They want to walk every morning, and they definitely look forward to Saturdays to come to the farmer's market. Let's go eat our blueberries and see what else we got.
My name's Kayla Morton, and I'm from Whitesburg, Kentucky. It's very expensive to eat healthy, so I would do it when I could, but sometimes it was just cheaper and easier just to eat whatever, and this has definitely made it a lot easier for us to eat healthier and, you know, provide better foods for the kids. I feel like it's improved my health quite a bit, and it makes me more motivated to do it outside of the walking program as well.
So it should be said that the walking program isn't the only special thing that draws people to the Letcher County Farmers Market. There's also the pharmacy program, and that's pharmacy with an F, where doctors can basically prescribe free farmers market vouchers for people with a range of health issues, including diabetes. There's also a community kitchen that feeds people year-round, a summer feeding program for local youth, and a series of free concerts on Market Thursdays over the summer, among other happenings. So is Whitesburg a special case? Or would the walking program be worth trying in other places too? Here again are Dawn, Christy, and Valerie.
Truly, what you need is people that are interested. It's a pretty simple model to implement. And where you're only given $10 and you can see some positive health markers. You can see behavior change. That's a little bit of money that goes a long way.
Especially you get rewarded for walking a mile. That's awesome. If we can move that needle around social norms or around ease of access, then we really improve a lot of people's health overall.
I have grandchildren that are 6 and 2 years old, and I want them to have a community to grow up in that they see health as a priority and taking care of themselves as a priority. And I want them to have choices for better work options. And I believe that food and health is at the base of that. So I feel right now encouraged. I feel that we are shifting. And if we can make a difference in our community, then these programs and these opportunities can be replicated in other communities across eastern Kentucky, Appalachia. I'll be very, very pleased, very excited.
All right. So in 2018, we did some qualitative analysis of the walking program, and our goal when talking to participants was to assess program use, including why people decided to join the program in the first place. We asked about impact on food behavior, what impact the program had on the community, and then areas for improvement. You know, what can we do to make this program better? So in the fall of 2018, I interviewed 25 walking group participants and conducted semi-structured, in-depth interviews. The results, I came up with 4 themes, and I'm going to dig a little bit deeper into each one of them. So like Lauren shared earlier, joining the walking program to manage chronic diseases was a recurring theme in the interview data. Most participants specifically mentioned diabetes. For example, Aaron shared that I'm diabetic, so I wanted the exercise and stuff like that. It helps the A1C. Other chronic diseases participants mentioned included things like high blood pressure and high cholesterol. And regardless of which disease the participant was concerned about, they all felt that the program encouraged them to begin or continue small lifestyle changes. Even participants who themselves were not struggling with health issues continued to participate because of their family members. For one example, Chloe said that she enjoyed the walking program last year, but then she started talking about how this year in 2018, her mother had joined her. She said, "My mom needed to lower her cholesterol, and she's been trying. She didn't want to take extra medicine, so this was kind of an incentive for her to join the program." Most participants understood the connections between what the walking program offered, physical activity, fresh fruits and vegetables, and a reduction in disease risk. They felt that this program provided the motivation and encouragement they needed to turn that understanding into action. So a lot of times when we talk about access to or availability of fruits and vegetables, we sometimes forget to pay attention to the quality and freshness of that produce. Every participant I interviewed was acutely aware of the differences in quality between the farmers market and their local grocery stores. For example, Monica Jefferson said, "You could tell a difference in the taste between what's grown and what you get at the grocery store. And I hadn't had any fresh strawberries like that somebody picked since, 10 years. You can tell a difference." Participants valued the quality of the produce and felt that this quality could only be found at the market grown by local farmers. And the market itself was really a point of pride for many participants, particularly lower income participants. Put very simply, Dawn told me, "I love supporting the farmers every bite I take." And for especially the lower income participants, the best way they could support their farmers was through programs like the walking program. All interviewed participants stated that the program and the farmers market provided opportunities to socialize with coworkers, friends, farmers, and even strangers. And the program also extended outside of the market as participants shared food and new recipes. So again, another quote from Don, he said, "This program brings some people out of their shell. Of course, I broke my shell a long time ago, but some people, the more interaction you get with other people, the more it makes you more outgoing." Multiple people commented on how, in the words of one participant, the program got a diverse group of people together. Regardless of health status and income, participants regularly shared market food with a wide variety of people in several diverse ways. And participants shared both raw produce and dishes that they prepared from market produce. Market tokens were also shared, and the line between sharing those tokens and the produce itself was kind of blurred. So before I read this next quote, I want to tell you a little bit more about this participant, Kyle. In 2018, he reported that his household income was less than $20,000, which he also indicated was not enough to make ends meet. He has a complicated health history, including diabetes, chronic obstructive pulmonary disease, arthritis, and heart disease. And during his interview, he shared this with me. He said, "I've got extra coins, and I see people in the market that maybe may not be able to get as much as I do. And I always take and get extra coins and get that and give them the extra coins. I don't have to know them. I do it just because I am that way. We share vegetables too. We get some extra stuff and stop by some place knowing they don't have it, and I give it to them." So the final theme has to do with the increased variety of fruits and vegetables in participants' diets. The $10 that participants received not only bolstered their ability to purchase food, but it also seemed to give them the freedom to purchase items they wouldn't have purchased on their own, often limited income. Purchasing new food also kind of naturally led to trying new and diverse ways of preparing that food. Even if participants never purchased a new food again, they often talked about different ways that they enjoyed the variety of foods available at the market. And so food can be shared and connect people, through eating that food and sharing that food together in person, but also through conversation. Searching for recipes for known and unknown ingredients made people look through their grandmother's cookbooks, they went to Pinterest, and they had conversations with farmers themselves. For example, Chloe, who I shared a quote from earlier, she's a self-described introvert. She's very sweet, but very, very shy. And she said she began a friendship with one of the farmers by asking the farmer how to cook kohlrabi. And from that single conversation about how to cook a new food, she told me that they really started a relationship that blossomed over the course of the farmer's market season. So that covers the main themes that came out of our qualitative data. Rochelle, I believe we're ready for the final poll question.
Thanks so much. That survey has been sent to our audience, so if you would just take a moment to select your answer. 5 more seconds.
Okay. So as you all read on your screen, the question asked, do you think members of your community would walk most weeks of a farmer's market season in exchange for a $10, am I looking at the wrong question? Nope, that's it. Okay, sorry. In exchange for a $10 farmer's market voucher. And just over 70% of people said yes, which is great. You're about to hear more in a minute from Callie, and hopefully she'll convince the almost 30% of you who said no that maybe they would consider it. So Callie was absolutely key to the success of our program. She was our community program manager. She was instrumental to inviting people to join the program, encouraging them to be comfortable communicating with her, and motivating them to keep coming back. And she'll talk more about this right now. So Callie, I will hand it off to you.
Thanks, Annie, for the extra credit introduction. Like she said, I'm Callie, and I'm the community program manager here in Whitesburg. I debated on what title, what do we call it, and professional Facebook poster was at the top of my list for what I could be called, because a lot of what I do is getting information from the research team at UK to the participants to the people in Whitesburg. And so this is just a list of some of the things I do, and we'll talk more about. I was a participant of the program the first year, and then kind of stepped up into a leadership role. So there's, let's see, some of the challenges that we had were we couldn't find a really good way to get the information about the registration and sign-ups for the program to the community. And so that was one of our first initial challenges. And we always had more people interested than we had open spots available, which is a good problem to have. And we tried to work around that when we could, but there were always people wanting to know, can I sign up? Can I sign up? When I didn't know, I missed that. So that was a major issue that we had. To get people, the retention and keep people coming back, like you all said in your surveys, people love free food, especially fresh fruits and vegetables. It was really crucial to a lot of people on an income level, and also just from the ability to get it is harder for some people than others. Establishing a relationship with people is really important to get them to come back. And I tried to make each participant feel that what they were doing mattered to the program, so that they would feel that their role in the program is important and that we needed their information. We had an attendance policy. It wasn't always enforced, but we like to keep it that if you missed 2 Saturdays in a row, that we needed to know, are you coming back? Is this, are you not enjoying it? What, just why are you not showing up? And the market mornings became a habit for most of the participants. They would come as a family and have breakfast, come with friends, and it just became, this is the first thing I do on Saturday mornings. I just get up, go to the farmer's market, then I start my weekend. Let's see, talking about the data sheets that we've mentioned a few times. those sheets included questions about what did you purchase at the farmer's market, how did you use what you purchased, did you freeze it, did you can it, did you share it with your neighbor, did you eat it, did it just go to waste, where did you walk, when did you walk, just basic, questions about the market. We usually use those as an exit slip, so you had to turn that in before you left the market. I posted constant Facebook reminders to people, bring me your sheet, turn your sheet in, where is this, call me and tell me what you bought, and I'll fill it out for you kind of thing. And that all changed this year with COVID. We did online data reporting where there was an online survey posted each week, and after you left the market, you had to log in and report that. It was less successful just with the rate of people turning in than the paperwork was. I think that's just once you leave, you're not thinking about it again until next Saturday. And these are just adjustments that we've made for COVID this year. We didn't do the physicals that we talked about to get the cholesterol and A1C, et cetera, numbers, because there was no way to do that socially distancing. Our market was wonderful as far as following the mask mandate. We set up hand washing stations at each tent. Hand sanitizer was available in several different locations. And I can't think of a single walking participant that didn't wear their mask. You see this couple in the photo here, they're just standing there with their masks on. But there was no issues with having to ask people to do that. Normally for our market vouchers, we give out a token, and each one's worth $1. They take it to the farmer, and et cetera. This year we use paper tickets, like the kind you get at Mr. Gaddy's, and so that way we could eliminate the reusing them. We just, once they got it from me, gave it to the farmer, and we threw it away at the end of the day. It was harder to keep our community feel going this year because we didn't encourage people to walk together. So it was some people walked with the people they came with, others walked at home. It was just kind of on the honor system how you walked this year. A lot of these impacts Annie talked about already. One thing that we hadn't mentioned yet was that since this program was not income-based, a lot of these participants are semi-well-off to well-off. So they brought cash to the market also, so it brought an influx of cash to the market. People have already been asking me, what are we going to do for next year? How are we going to do the sign-ups? People that were in the program and people who were not are saying, put me on the list. I want to be in the walking program next year. And like we talked about, the community aspect of it, one couple used the Saturday mornings as their kind of weekly date, and they walked together every Saturday morning and ended up marrying at the end of the first season, and they still come consistently every weekend. People take it very seriously about being there on time. One lady was going through chemo the entire summer, and I believe only missed once or twice. One person had surgery on Thursday and told her doctor she needed to be released so she could be at the market on Saturday morning. There was one lady who moved to Lexington in the middle of the season, still drove to Whitesburg on the weekend to come to the farmer's market. So people really want to be involved in this. Lots of new friendships have been made. I've met lots of new people, it's just been a really good program to get people together from different groups. And like I said, making the connection with the participant is super important to making this work. Like Dawn was mentioning, the group from Harlan had really no interaction and were not interested in coming back for their follow-ups. But we didn't seem to have any issues with that here. And I think it's because we were talking to everybody on a weekly basis. And so I'm going to turn it, that's most of what I have about the community involvement. I'm going to turn it back over to Valerie for information about how to spread a program like this.
Thank you so much, Callie, and thank you for showing up every Saturday morning and connecting whatever time those Facebook messages and posts came in. It does begin, anything that has success begins with successful relationships, and thank you for doing that. I'm also really proud to be a part of this team, and Dawn and Annie, thank you all for that good information that I sometimes take for granted. Lauren, thank you for being here. I think because we have some really good questions, I'm going to forego any other remarks I had and go straight to the questions because they're very, very pertinent and lead us into this next section. And I want to recognize Martin Richards with Community Farm Alliance has put a couple of good questions out to us. And I also want to recognize that CFA was a strong contributor and an important role in getting this walk-in program off and with the first steps of it. I was working with Community Farm Alliance as a Healthy Community Initiative leader at that time, and it was a opportunity that we were given freedom and support, an opportunity to explore and move on, as CFA did with many things at the City of Whitesburg Farmers Market through the Farmers Market Support Program. So that is a definite there. And one question that came from CFA was how do these programs, how do they work if other programs are happening at the market, such as Double Dollars and pharmacy programs? And my thoughts on that is that it cannot have too much overlap. Sometimes we'll have a mindset that we might look at things like that as a person is double dipping, but I look at it as just a stronger motivator to change habits. Some of our participants I can think of were Grow Appalachia participants. They had help raising their own garden with plants and supplies. They had help with canning classes. They would get produce at the market, maybe get it doubled. And it was just layers of opportunity and messaging to make that connection and just to really see the gains from that. So it was nice. And this one was also nice because a couple programs at the market have limits, criteria to be able to participate. This one did not, so it was a stabilizer there to have different faces at the market. The next question that Martin asked is, what would it take to make this program available to Kentucky's 160 farmers markets? And Dawn, I'm going to pass that to you. I can tell you how it looks on the ground here, but I want Dawn to answer because I have learned just doing something is not enough. You've got to have the data and the research that shows that it's been a success or not. So, Dawn, I'm going to pass this to you.
All right. Thanks, Val. And Martin, thank you so much for your question. So I would say that, yeah, I mean, Val's correct. I can't tell you from that on the ground, the farmers' perspective of how to make it happen. But as far as getting people's attention, I think ultimately policy would be the way to spread it to all 160 farmers markets. And to do that, it's I think just as a network, and I think CFA is a great channel for this because you obviously are connecting the farmers markets together. But if communities, it's got to be several communities doing this program, and if it can be implemented in a somewhat similar manner, it doesn't necessarily have to be a cookie cutter because communities are different. So that has to be, respected. But if there are some common indicators that could be collected and then shared, with policymakers, I see that as a way to get that, maybe someday to get this as, a line item in a budget. And we're going to see policies similar to like double dollars and such. Because, granted, this program, it's not for everybody, but it is for a lot of people. I'd say the health problems we've talked about today span across the lifespan. It spans across, economics. So encouraging people at any age, to be physically active and to eat more fruits and vegetables is going to be beneficial to all. So, I would say we really have to work together to collect that. So similar indicators and then get it to policymakers and to show that this program's having impact and that people will do it. Thank you.
And follow up on that for on the ground here, I look back at some of the first early years that the market was 16 weeks. So it was a $160 investment in the individuals that participated in the walking program with their $10 each week. And there was minimal cost at the market to execute and administer the program. And to see those health results and that benefit in individuals' A1C or their weight loss, to be $40 a month and to make an impact, that seems pretty significant and like a wise financial choice for those who invest in the health and well-being of community and who benefit from that. So I like that. Do we have any other questions, or did we answer that question well? Any other comments?
Yeah, thanks, Valerie. This is Rochelle again. There is a yes or no question about the self-reported how much people walked. This was presented at the beginning. So was that a self-report or was it mapped out? How did you all measure how much people were walking in your program?
There's definitely.
Go ahead. Oh no, go ahead, Val. You were on the ground. Go ahead.
No, there's a level of trust that comes with that. Our first year, it was just you meet at the swimming pool at 10 a.m. and you walk to the farmers market. And what a great sight that was. We had our pharmacy program that would begin at 9 o'clock, and there might be 100 participants that were there to buy and receive fresh fruits and vegetables from that. And about the time that rush was over, and it was a huge rush, you would look at the walking track, and here would come this other line and core of people. That's when Lauren first got involved. He was the general, and he led that march. And so there's this bonus in addition to the help. When you see this core walking, your customers are dwindling. So here come 100. Our largest day had 99 people that are each going to get $10 that can be spent at the farmers market. So it was just such a boost there. So that was the first round and the first way we did it. After that, there are many factors that caused us to default to allowing people to walk when they wanted to walk. Some wanted to shop at 9 a.m., so they would get there, do their walking earlier and be ready, but there was a level of trust with it. We did pedometers for at least the first year, and some of our participants, I can remember seeing them 6 months later. They're still wearing this pedometer on their belts.
That's fantastic. Thank you so much, Valerie. That's great. I picture that in my mind. I can see everyone at 10 a.m. and launching out to do their walk for the day. That's a fantastic visual to end us with. So this is Rochelle Seeger with the Foundation for a Healthy Kentucky. I want to thank especially our presenters today and our guest presenter, Mr. Smith. Thank you so much for sharing your story. To all the folks, thank you, Martin Richardson from the Community Farm Alliance and the other people who sent in questions. We will do a follow-up to get questions to you directly about that. We appreciate you chatting in questions. And for all the participants, we had a huge variety of people on our call today, from mental health to Kentucky school systems to community development, the Louisville Family Justice Advocates, and Kentucky Department for Public Health, and our healthcare systems, and Apple Shop, and Community Farm Alliance, as I mentioned, and our health insurers. It will take all of us to work together to improve health in Kentucky. So I'm thrilled that you took time to join us here today on this Health for a Change training series. I will send you my email with a survey this afternoon. It has been a great joy to share this hour with you today. Thank you for being with us. Be well and stay safe.